Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over Actisorb. You can see that. So we're going to be going over the application and removal of this dressing. But first, if you could hit that subscribe button, it would greatly appreciate it, as it truly does help my channel. So let's get started, guys. So we're just going to talk about Actisorb for a second, because this is a really awesome dressing for odor. Okay, that is what we use Actisorb for. So it has activated charcoal with silver in it. So the activated charcoal, it traps the bacteria, and the silver kills the bacteria. Okay, and then it absorbs the bacteria's toxins, which decrease the odor from the wound. Okay, so the activated charcoal and the silver work together to kill the bacteria and absorb the bacteria's toxins to decrease the odor. Okay, so that's what this dressing is used for, and it works very, very wonderfully. So as in all wounds, we need to make sure that if there is any dressings on the wound, that they are removed. And then we are going to start by cleansing the wound, okay, with sterile saline or sterile water. Okay, either or you can use on with this dressing. Now you just flood the wound. Use the whole bottle, because a lot of times people will just like kind of clean the wound, go over it, and they're not using the whole bottle. You're not going to reuse the bottle. So just really cleanse that wound. We're irrigating, getting any bacteria, any microbes that we can't see. We can't see this stuff. So we need to be cleansing it very good. Flushing it, flushing it, flushing it. Okay. And then you're going to dry the peri-wound area. Now you want to make sure if any fluid is sitting in that wound, if it's a deep crevice and they're laying flat, it'll kind of just sit in there. Kind of tip them a little bit and the fluid will run out, and just pat dry the peri-wound. Okay, you don't want to dry the actual wound base itself, because you do want a just moist wound, so you want to leave that moist, a little bit of moisture there. And now when we get into these dressings, now they come in all different sizes. Now you want to make sure that you're choosing the correct dressing size. As you can see here, I always like to cover the peri-wound by at least 2 centimeters to make sure that no moisture is just sitting there from the wound. So I have it like this, but you want to make sure that this outer dressing is covering the wound completely. Okay, you cannot cut these dressings. Okay, they do have to be completely sealed. I'll open this up here for you so you can see it. Okay. So this is how it comes. This cannot be cut. If it is cut, it will not work properly, okay? It's a very soft material, like it's very material like it's like nylon. But once again, it's completely sealed to keep in the odors. You cannot cut this dressing. So we're also going to apply this dry. You don't get this wet at all. The exudate will activate it, okay? So you just put it on completely dry. Once again, it is super soft for that wound. It's a very comfortable dressing to wear. So you do need to cover this with a cover dressing over top, which I'll show you in the next slide, how you can choose different cover dressings. But you want to make sure that you have a cover dressing over it and it is sealed. Okay. I personally, I don't use like Tegaderm, Duoderm, anything like that. But I will show you more of the dressings here in the next slide. So as I was just saying, I've never used a film, hydrocolloid, or acrylic with this particular dressing. Now, my reasoning for this is because you have drainage, okay? Obviously, if a wound has a lot of odor to it, you have a lot of drainage coming out of it. Okay, whatever reason it might be, either infection or it's a cancerous lesion, whatever the reason of the odor, you're gonna have drainage with this. So it's always about moderate to up. I never, ever use these ones here, but I just left it in there to show you. So it's always gauze, foams, high absorbent pads, super absorbent pads, anything like that along these lines is what I'm using along with this. And then you're just sealing however you're going to hold a cover dressing on there. That's all you have to do with this. So to remove this dressing, so you just take off the cover dressing as normal, but to remove this, if it is sticking, you can saturate it with normal saline on removal, okay? Once again, you're going to let it sit there for a few minutes and it should come off very smoothly, okay? It is non-adherent contact layer, and I've never had a problem with them sticking because normally there is a lot of exudate coming from it. Now frequency change with this dressing, you're going to, you can leave it in place for up to 7 days, but you want to change it when it no longer manages odor. Okay, that's when it needs to be changed, is when you can start smelling the wound. Now, with that said, if the cover dressing is saturated, okay, for the more heavier exudating wounds, it needs to be changed more frequently. Obviously, the more exudate that's going through this, it's going to lose its ability to manage odors more quickly. So it'll kind of happen at the same time because only so much fluid can go through here before it stops managing odor. Okay, so the expected outcome of this dressing is obviously that we're managing odor. With that said, this is an antimicrobial dressing. We are using it on wounds that are either cancerous or that have an infection. We always need to make sure that we are managing the infection properly, okay? So use your nerds and stonies. If you're not sure what nerds and stonies are, I will link it somewhere here in this video. What nerds and stonies is, though, it's a easy way of determining if we have a local or superficial infection or a deep spreading infection that needs an antibiotic. That's exactly what the tool helps you do. And I do have a video on that. So once again, I will link it. But this dressing, it does have an antimicrobial in it, which is the silver. Okay. So it does help with infection if we do need that. This would just be for like a local infection. Now, for the deep spreading infections, you use a topical antimicrobial along with the antibiotic. Okay. I hope you did find this video very helpful for either your clinical practice or if you are using this product at home. And once again, if you did enjoy this video and want to see more videos like this, please hit that subscribe button, as it truly does help my channel. But that's all for now, guys. I hope to see you in my next video.